This video is on how to set up a sterile tray in a physical therapy setting. The first thing that needs to happen is that you need to wash your hands. The World Health Organization states that washing hands for 40 to 60 seconds is optimal. The water should be warm, should not touch the sides of the sink. Hands should be in a downward motion, lacing with the fingers and the palms of the hands. When you go to dry your hands, having a towel where you're not actually touching the towel dispenser, drying your hands completely, and then using the paper towel to turn off the water. First thing you need to do is get your materials ready. Make sure you looked at your materials and they all are sealed in the packages and there is no water damage on them. Then you're going to put the materials onto the sterile field, making sure not to actually touch the contents inside the sterile package. You're opening them and you are putting them in the sterile field. Notice how I'm not dropping high up in the air, which could trap dust particles or germs. You're going low to the table, but not touching anything on the table. Now, the next thing you need to do is put on your personal protective equipment, putting on the foot covers. And then if you had a head bonnet, this is where you would put that on at this time. And before you put on the gown and the mask, you would actually wash your hands again in a sterile scrub situation. For the purpose of this video, we're going to continue on with the personal protective equipment. Finishing with the gown, which normally would be in a sterile package that you would be opening up near your sterile field. But again, for the purpose of this video, we're just using an isolation gown and not in a sterile fashion. Once you have your personal protective equipment on, you're going to go back over to where your sterile gloves are. At this point, you're going to open your sterile gloves. You may touch the outside of that package that the gloves are in. You're going to lay it in front of you like a book with a right and a left half. Once you open it, these gloves are sterile. You're not allowed to touch the gloves. Remembering there's a 1-inch border that's considered unsterile around the outside of this package that you're seeing. With one hand, doesn't matter if you do right or left hand first. You may touch the cuff, as I am doing there. You need to pull the glove up and away so it doesn't touch anything on that table. The next glove, you're reaching in under the cuff. That's considered sterile, sterile to sterile. Now you're putting the next hand in. And then you're going to pull the cuff over the outside, coming back on the other side, being careful not to touch the inside of that glove. Now you have sterile to sterile hands. You may come back to the sterile field and you may touch your instruments and put them where they need to be on the tray. This is an example of setting up a sterile tray.